What's up, everyone? Welcome back to the Middle Ground. I'm your host, Sean Sood. Today, we go deeper into one of the most complex debates of our era vaccines, their history, governance, controversy, and the drama unfolding at the highest levels of U.S. public health. In this episode, we're not here to tell you what to believe. Instead, we'll walk through layers of context history, politics, ethics, trust, and yes, that explosive September 4th, 2025 Senate hearing with HHS Secretary Robert F. Kennedy Jr. You'll hear stories, data, and conflicting voices. I'll pause to reflect. You decide what resonates. Let's start with history, not just what happened, but how debates formed. Centuries before modern vaccines, people experimented, like in 16th century China, where powdered smallpox was inhaled, or in the 18th century Ottoman Empire, where variolation took hold. Then came Edward Jenner's famous 1796 experiment, him observing that cowpox seemed to protect against smallpox, leading to what we now call vaccination. Smallpox was declared eradicated by the WHO in 1980, a remarkable milestone. Supporters say this shows vaccines can be transformative, but skeptics note that better sanitation, improved nutrition, and healthcare advances also played a role. The 19th century even had anti vaccination movements. Britain's Anti Compulsory Vaccination League rallied against mandatory inoculation. Fast forward, polio vaccines in the mid 20th century were hailed as a breakthrough. In recent decades, HPV and COVID 19 vaccines captured public attention, sometimes stirring enthusiasm, sometimes skepticism. These cycles of innovation, fear, improvement, and backlash keep repeating because trust, risk, and politics always seem to mix. Now, moving to how the system works inside the US. Firstly, the FDA approves vaccines, following which the CDC, via its Advisory Committee on Immunization Practices, or ACIP for short, recommends who gets them and when. Usually, this is cautious. Long trials, peer review, lag time, protecting safety at speed's expense. But during the COVID 19 crisis, emergency use authorizations blew that fold open. Some say that was science rising to the moment. Others worried it created dangerous precedents. In 2025, we still see the reverberations skepticism from the public, confidence debates inside public health institutions, policy reversals, and yes, that Senate hearing unfolding this week. Some recent moves raise question of process and science. In October 2024, the ACIP recommended COVID 19 booster doses for those aged 65 plus and people with weakened immune systems, a tailored, risk based decision. Supporters called it protective. Critics argued constant boosters could send confusing signals. In June 2025, the ACIP voted to remove thiomersil, a mercury based preservative, from most flu vaccines. This sparked debate. Long standing studies have shown no harm, but precaution is not the same as proof. Critics asked whether political optics prevailed over evidence. Beyond that, in May 2025, under Kennedy, the FDA limited annual COVID boosters to older adults and those at high risk, even bypassing traditional advisory review. The US also stopped recommending COVID vaccinations for healthy children and pregnant women, a shift that some saw as narrowing access. Kennedy canceled a $500 million Moderna contract for bird flu vaccine development. All 17 members of the CDC's vaccine advisory panel were fired, replaced with new appointees seen by some as ideologically aligned. The FDA independently selected virus strains for the flu shot, sidestepping past voting processes. These actions happen against a backdrop of growing distrust. Some argue Kennedy is unraveling institution standards in pursuit of a new agenda. Others say he's trying to reform a broken system. One of the flashpoints, the firing of CDC Director Suzanne Moneris in late August 2025, just under a month after her Senate confirmation. She was the first CDC director confirmed by the Senate under a new 2023 law. Moneris later wrote in a fiery op ed in the Wall Street Journal, claimed that Kennedy tried to pressure her to pre approve recommendations from a newly composed advisory panel, one filled with voices critical of vaccinations. When she resisted, she said, she was pushed out. On September 4th, under intense questioning, Kennedy denied having asked Moneris to pre approve anything, or having even met her privately, calling her claims false and at times patently ridiculous. Moneris' attorneys stood by her statements and said she would repeat it all under oath, a position affirmed by career health officials and reporters. In the wake of her ousting, four senior CDC leaders resigned, including the chief medical officer, Dmitry Diskalis, signaling deep internal turmoil. On September 4th, 2025, during a Senate hearing, Kennedy delivered hours of testimony as questions raged from both sides. Republican Senator Bill Cassidy, himself a physician who helped confirm Kennedy, grilled him on canceled vaccine contracts and narrowing eligibility. I would say effectively, we're denying people vaccines, Cassidy said. Kennedy replied, well, you're wrong. Cassidy pressed Kennedy to say whether Trump's Operation Warp Speed deserved a Nobel Prize, and Kennedy agreed. Then, Cassidy asked why Kennedy had said vaccines kill more people than COVID. Kennedy denied having made those claims and was evasive on affirming that vaccines saved lives, though he later acknowledged that they prevent deaths, without specifying numbers. Senator Mark Warner pressed Kennedy on acknowledging the scale of COVID deaths in the U.S. more than 1 million. Democrats, including Senator Ron Wyden, demanded accountability and labeled CDC ethics as shredded. Calls for resignation followed, not just from partisan quarters, but also from 9 former CDC directors. White House watchers noted that Trump publicly defended Kennedy, praising his different ideas and urging pluralism in health policy. But the clash between executive backing and bipartisan dissent underscored how polarized the moment is. According to ABC News, one key takeaway was how the hearing revealed a collapse of certainty on vaccines, from the science, the messaging, and the leadership. In the end, the hearing was less about policy details and more about narratives, who controls public health science, and whether institutional trust can recover from these fractures. The echoes of this conflict are widespread. 9 former CDC directors, both Democrats and Republicans alike, wrote a scathing op-ed saying Kennedy is actively endangering public health. They cited mass resignations, dismantled programs, and their concern for rural and vulnerable populations. Meanwhile, the political left and right still continued to diverge. On the public side, some groups like Moms Across America doubled down in support, viewing Kennedy as a rare ally, espousing inflated concerns about vaccine autism links, even as most research confirms no causal connection. Trust surveys show a split electorate. Some cry that public health just became weaponized by ideology. Others cheer political disruption as long overdue. But fractured trust means inconsistent uptake in messaging, leaving communities in confusion more than ever. With faith faltering at federal levels, states are moving. California, Oregon, and Washington formed the West Coast Health Alliance, a coalition pledging evidence based vaccine guidance amid CDC instability. In Massachusetts, insurers are now required to cover vaccines approved by state health authorities, even if federal guidelines change. Some see this as pragmatic resilience. Others worry about policy patchworks fueling inequality and confusion. Earlier in 2025, the US suffered its largest measles outbreak in decades. Multiple states, hospitals, deaths, all among the unvaccinated. Health officials called it a red flag. Skeptics countered that natural immunity is underestimated. Either way, it highlighted the consequences when vaccine coverage wavers and when messaging breaks down. Zoom out internationally. Vaccine narratives vary globally. In Africa, the long awaited malaria vaccine is finally rolling out. Years of coordination, hesitancy, criticism, and breakthroughs. In parts of South Asia, polio campaigns remain critical. Cultural, political, and historical baggage shape local trust in immunization programs. Ethically, the debate is deep. Should public health prioritization override personal liberty in the name of collective immunity? To what extent should profit, mandates, or oversight feed policy? Countries differ. Some mandate, others persuade, Many compromise. Vaccine debate is never just scientific, it's social, moral, and cultural. Looking ahead, vaccine innovation continues, even amid policy turmoil. Microneedle patches promised needle free, temperature stable delivery, potentially transforming global immunization. AI and computational biology are speeding vaccine design, though the public may still recoil if something not understood lands in arms. Science pushes forward. Trust may not follow unless institutions rebuild credibility. So, where do we land? We're mid debate between scientific evidence and political backlash, between safeguards and disruption. No side has full control, no narrative is absolute. Vaccines are neither unquestionable miracles nor inherently dangerous. They're tools, powerful ones, shaped by leadership, policy, and public perception. The September 4th hearing revealed more than disagreements. It exposed cracks in the system. Trust is torn, governance is volatile, yet innovation persists, and states, communities, and global advocates adapt. You don't have to pick pro vaccine or anti vaccine. You can stand in the middle, informed, critical, and empathetic. Thanks for listening to The Middle Ground. I'm your host, Sean Sood. See you in the next episode.